Vehemently disputed claims that the COVID-19 vaccine will be arriving in the country as late as December this year. The government says it has already set aside a budget of 930 million shillings in order to ensure the first batch of the vaccine arrives in the country by the end of this month as planned. Zaida Mohammed has the details.
Controversy continues to surround the arrival of the COVID-19 vaccine in the country, with the Ministry of Health now disputing claims that the COVID-19 vaccine February arrival is a lie. According to the ministry, the government has already set aside a budget of 930 million shillings to ensure the first batch of the vaccine arrives in the country as planned.
Coming to you because we are disturbed, and we are quite disturbed because the issue of the vaccine rollout against the coronavirus disease in the country has taken a direction of misinformation. Just for the record, a story carried out by the Standard today that the rollout of the COVID-19 vaccination will begin in December is, to say the least, misleading and a total fabrication. When we stood here a fortnight ago, we informed you about the deployment plan for the COVID-19 vaccination in the country. And during that briefing, we informed you that COVID-19 vaccination will be rolled out in 3 phases, with phase 1 happening this quarter. This position has not changed.
The ministry further says UNICEF will be facilitating the transportation of the vaccine until the port of entry, where the government will take over and transport the vaccines to a storage in Kitengela.
UNICEF is going to support the transportation of these vaccines up to our airport, port of entry. And from there, the government will make arrangements to take them to the central vaccine stores in Kitengela, which can hold enough stocks of our COVID-19 vaccines that could take us almost throughout the end of the year.
Once the vaccine is here, the ministry says the county governments will take the forefront in piloting the first phase of the vaccination exercise that will begin with the health workers at the level 3, 4 and 5 hospitals across the country.
The vaccination will basically take place within the counties. So a lot of activities are going to be at the county level. And already we have engaged the counties, and we are making plans on how they will conduct micro-planning. Micro-planning meaning that there will be various issues that at national level we may not understand, including the issue of healthcare workers. The counties themselves are best placed to know whether they have adequate healthcare workers at the vaccination posts, if they need to do internal redeployment within the same, because in the first phase we are going to use level 4, 5 and 6 hospitals, and then we'll continue to start using the others.
The exercise will be closely monitored through a platform specially designed by the Ministry of ICT, including the number of people vaccinated, the stock of the vaccine used up, and any possible side effects among the vaccinated persons.
There's a lot of work that has been going on to ensure we have a digital platform that will ensure that data is captured to track the people vaccinated, to track the stocks of the vaccines, to also monitor the side events.
To counter hesitancy among Kenyans, starting next week, the ministry says it will be engaging Kenyans in order to inform them about the vaccines, whilst demystifying any myths and misinformation.
My task force has experts, and we are going to reach out to other experts with the right information that are going to engage Kenyans through all forms of media, TV, radio and social media, to give them the right information, and you are going to see that increase from the coming week.
Even as the government continues to keep the hope of the vaccine among Kenyans alive, whether or not the vaccines will be here in 2 weeks' time is a matter of wait and see. Zainab Mohammed, TV47.
President Uhuru